Hi everyone. Hello. Good afternoon. Good evening actually. So sorry. I'm Amrita. I'm a content writer at Boldsky, and today I bring you Dr. Shweta Mittal. She's the IVF specialist and gynecologist at Sri Gangaram Hospital, Delhi, and she's one of the most I would say renowned IVF specialists in India, and she was awarded the sorry and she was awarded by the Economic Times in 2020, if I'm correct, for one of the most aspiring IVF specialists in North India, actually. So, welcome, ma'am. Thank you so much for giving us your time today. And yeah, so shall we begin?
Yeah, sure. Thank you so much for the kind introduction.
All right. The first thing I will go ahead, right with the question of how, according to you, is the IVF scenario in India? How would you like to, like, for our viewers, how would you think IVF has helped or, is helping, like, women who are not able to conceive, give birth and everything?
I can definitely say that in the last 19 years where I am in this sector, there has been a lot of change when it comes to IVF. I think over a period of in the last decade, I definitely see that the acceptability of IVF, because if you're looking at a huge population, we are looking at urban population, we are looking at semi-urban cities, and we are also looking at rural areas. So slowly I can see that people from all the different sectors have opened for the concept of IVF. We still do have our own barriers which patients do have. They could be religious, they could be economical barrier, because it's still not funded in India, and they could be personal issues or non-approachability. Maybe people are staying in cities where they don't have, approach to IVF. So yes, that challenge is there, but however, I think the acceptability and the availability of IVF services has definitely increased in India, leaps and bounds.
Oh. All right. So in your working, you have been working in the IVF field for 17 years now.
Yeah, to be precise.
Yes. Okay. So in those 17 years, according to you, what was one of the most challenging, something that stood out, case that you could talk to us about?
So,
Like, in line with the challenges, actually.
over a long period, what I'm seeing is that at least in my center, because it's the center of excellence, what we deal with is a lot of repeated failed IVFs. So yes, they are very challenging. I mean, doing IVF for a person who's never gone through the procedure any time before, and then dealing with cases who have gone through, say, 3 failed IVFs or 5, 6, even more IVFs is very challenging, and it's difficult. You need to come to a conclusion. It needs a lot of finesse. It needs a lot of brainstorming, that what would work for this particular patient. Also, sometimes convincing advanced technology to the patient, because we know that advanced technology also comes with a bit of a more cost, can be sometimes challenging. Or, some patients with repeated IVF failures, some advanced technology, yes, that can be challenging. Some religious issues where they don't accept certain procedures of IVF, where we know that yes, that procedure will work for them. So that can also be challenging. So there are many areas where we can face these problems.
Yeah. Okay. So it's like actually it's according to the background of the people, we could, categorize
And
the
also,
challenges.
everybody needs to understand that starting an IVF procedure does not mean success always. IVF has, a particular success, and even the best of the centers, it will not cross about 50 to 60%. And so, if the patient has a false hope, and it is so important to tell the patients before they start the IVF cycle that what is the realistic chance. It is not that we are discouraging them, but if they are realistically prepared, then they are ready to accept even the negative results. So it's not that every patient will have positive result, but yes, if you try and you are in the right place and the right, stimulation, the right regime, the right procedure, then yeah, most of them will make it.
Okay. Who do you think should consider getting IVF, and who are not the right candidates for it? Like considering that IVF is flourishing in India right now.
Yeah, so outrightly, now women who have had tubal blocks. Okay, so it's been
Mm-hmm.
proven that they've had pelvic infections or previous surgeries which has led to tubal blocks. They need to go for IVF outrightly. Then very
Mm-hmm.
long-standing unexplained infertility, where everything is normal, but a lot of treatments have been tried. They have never conceived naturally. They have never conceived with other procedures like IUI or ovarian stimulations. Definitely need to go for IVF. Then advanced maternal age, even if they have shorter duration of infertility, yes, they need to think of a more active, treatment. Then let's look at the male part. Now, those men who do
Mm-hmm.
not have sperms, in the semen, but they still are producing it in the testes, or there are, blocks right from the birth, congenitally blocked, passages for male, but they are producing sperms, will outrightly need IVF. And then IVF is also for couples with, known genetic disorders. Like we get couples with thalassemia major, where children are born. I mean, couples are carriers and children are majorly,
Mm-hmm.
and they don't want, an affected child. And there are like multiple genetic disorders for which, genetic testing can be done. And then a second of patient who are coming is fertility preservation. So in this lockdown period itself, I can recall so many, boys, girls, married, unmarried, who have come for fertility
Mm-hmm.
preservation because they're going through cancer therapy and they know that they will lose their fertility. So they need to come up, and we can, freeze the eggs for the girls, we can freeze the semen, which is much more easier for the boys. And yes, we can go ahead with that.
Mm-hmm.
So these
All
are
right.
the kind of couples who would outrightly, need IVF cycles.
Okay. All right, ma'am. So, for example, if a woman had a baby naturally in the first time, can she do it in the second, second, like, can she try IVF in the second time, if it's not happening naturally for her?
Yeah, so see, we normally have a cutoff of about 2 to 3 years. Also, we look at
Okay.
the age of the female partner. So, suppose she's had a
Mm-hmm.
child earlier, it's a good sign because her ovaries worked, her tubes worked, and they don't outrightly need IVF. But yeah, maybe there could be some events in between, like the male partner had very poor, semen count in the meantime, or this could happen that she had pelvic infection and the tubes are blocked, or for some unexplained reason where she is not getting pregnant. Yes, if you have tried everything, like starting from the basic, starting from tubal test,
Mm-hmm.
ovarian stimulation, maybe offering them IUI, if all that
Mm-hmm.
seems to fail, then yes, even these people will need IVF. And they must start thinking, because this is a very common misconception where women or couples think that, because I've had a child once, I will never need an IVF service at all
Yes,
in their
yes.
life. Yeah. So that's what delays the time to pregnancy, and that increases the age for the female partner, which is very, very important.
Okay, so one of the viewers has asked, questions related to what we're talking right now. What is the right age for childbirth, like naturally, and is there any complication if a couple try for a baby at the age of 30?
So there's no right age. See, any woman who's I would say more than 21 years, 18 is the age of marriage, 21 is the age for pregnancy. But if you ask me what is the most optimum reproductive age group, yes,
Mm-hmm.
it is somewhere between, say, in early 20s till early 30s. The moment you hit mid 30s, then you are looking at declined fertility potential for a female partner. It's not that men are never infertile, they can also be. Even men more than 40 years could be, but the fertility aspect is more important for female partner when it comes to age. So it's not like there's a particular age or an year when you're going to get pregnant, but yes, from early 20s till early 30s is like the best decade for reproductive.
All right. And then, so as you said, not every IVF has to be a success in the first try. So, what do you think is the success rate? Like, where is it? Like in India,
So success is so highly dependent upon the kind of patients you are dealing with,
Mhm.
and also it is so highly dependent upon the IVF lab performance. So because these are the two most intrinsic parts for success, we cannot
Mhm.
change the indication for which the couple is going through IVF. But what can be brought about is the finesse, the way you work, the way your lab functions, and very tight quality control and quality assurance in your IVF setups. And I would say that it is very important to very prospectively keep your data and to analyze them. It's like in my center, there's a daily data keeping, because the moment there is a problem, you need to identify within a week. You cannot go back after a month where the damage has already been done. And you need a very standard qualified embryologist. You need the right number of incubators, the right media, the right culture conditions, the right air quality, the number of patients. So there are multiple factors. If you say, is there a single factor which affects the IVF results? No. There are maybe 50 steps in IVF and all 50 matter. It's like this.
Okay. All right. So another relevant question is, can you give us an idea of transgender IVF fertility treatment and preservation? How is it for?
Well, I'm not dealing with transgender population. However, what I understand from your question is, yes, like very recently we came across a couple where one female partner has gone through a sex reversal. Now for them, of course, the female partner, the only option left is an IUI with donor semen. So this is how it will be going about, depending on what is the case who comes to us.
Okay, all right. Another question is, ma'am, is it true that you can decide or ask for a specific number of babies to be conceived? Like, for like if a couple want to have twins or triplets through IVF, like, is that possible?
It's a very important and pertinent question you have asked. See, I think if we look at natural conceptions, the natural conceptions by law are singleton. And you get twins 1 in 80 pregnancies, and you hardly see triplets in a natural pregnancy. So why should you be giving triplets to a couple, which is so difficult to carry even in an ART pregnancy? So for the last couple of years, many years, we never ever increased. Our 70% of cycles are single embryo transfer in Gangaram Hospital. We're very happy because we have gone down on twins so much. It is not by choice that you need to give pregnancy, but what is important is look at the health of the woman. Now,
yes, that's very important.
Single pregnancy. So why not give them a single pregnancy when twins, and more than twins, we can't even think of it. We haven't put three embryos. You will generally not come across triplet, barring one odd condition where one embryo breaks into two, which is a very, very rare situation and unavoidable. However, what better labs need to do is to go down on the number of embryos, because you are so confident that your every single advanced embryo is bringing a beautiful implantation and pregnancy rate and a very high success rate. So why should you be hesitant to put a single embryo even in an Indian setup? So if you're very confident of your lab, if you're very confident on your results, then yes, the better the lab, I would say lesser is the number of embryos they would be transferring.
Okay, all right. And
the choice of the patient,
Yeah, because it was one common questions that I saw while I was researching the IVF, because so many people had asked the question, like, can I specifically have twins, or can I specifically have triplets because I want that? And I was like, okay, do you really have the option of
There are a lot of requests for couples, that they do twins because they feel that having twins finishes their, completes their family, but that's not true. Look at the flip side of twins, where there are higher chance of bleeding issues, miscarriages, more medical disorders like diabetes, hypertension, more discordant, weight differences in the babies. So if you look at the advantage and look at the, problems what you're dealing with twins, you would definitely, counsel the patient. It's very important because patients can come with any notion. It is my duty to counsel them that how a single pregnancy is so beneficial. So it's not that all pregnancies are single. However, our majority IVF pregnancies are singleton now for the last maybe 5 or 6 years or even more.
All right. How does the procedure affect the male body and the female body? Like, how is it a painful process, or
So IVF, for male partner is fairly simple because they need to, give a semen sample unless we're taking it out from the testicular area. For men who are azoospermic, yes, it does involve a bit of a discomfort, but that also is offered under anesthesia, local. For women, yes, as a couple, I would say a lot of emotional turmoil, a lot of psychological aspects which we need to look into because they have very high hopes. They feel that it's maybe the end of the road where they have reached, and if this procedure is not successful, maybe they will never be able to achieve a normal conception. More than the physical part, I would say it's the mental, psychological part. Physically, it involves a procedure for about 8 to 10 days. We have made the procedure very simple. The lesser injections you give, the simpler injections you give, the finer injections you give, the better it is for the patient. So yes, there are methods where you can make your treatments simple, more ergonomic, I would call. And by and large, I see that patients who come to us are comfortable, they are more happy. Of course, nobody likes to take any injectables, but they are in a similar way, I say, the way diabetics take insulin. So they are with smaller needles, finer needles. We don't call them to the hospital daily. We teach them so that they can self-administer. They are so simple that even the most uneducated person can take these injections themselves. So they're easily marked. I would say that the procedures are becoming simpler, though they are not like the normal. But yes, they can go through it.
Okay. And I had seen a series where the couple were trying for IVF, and they were supposed to take the second shot of it at exactly one specific time, and they missed it, and she was losing it. So I actually want to ask you, does it actually matter?
Yeah, so I always tell my patients that it's not like, a line which they have to follow. Suppose they've taken an injection at 6 in the evening and she's busy at 6 the next evening, you can take it at around 4. So 2 hours here and there really will not make a difference. Sometimes patients have missed one injection or taken it wrongly. So just to inform that during an IVF cycle, even if you have accidentally missed 1 day of injection, it doesn't hamper the IVF results. But if you've missed over 2 days of injections, then yes, you can have a dramatic, change in the IVF outcomes. And then maybe we can just postpone the cycle, keep the remaining injections in the fridge, and we can restart the cycle. So 1 day and 2 hours here and there, please don't be disturbed so much.
Okay, because after I saw the series, I was like, okay, this is a really, a serious procedure, and they missed 1 minute. And, I was thinking, how does that go hand in hand?
That's not true, yeah. So it's only that last injection which is timed and which we tell them because the egg collection is time dependent on, the time of the last injection. So that is very important.
Oh, okay. What are the potential side effects of IVF? Like, why we know the many benefits of it.
Two important side effects. One is ovarian hyperstimulations, where the ovaries get overstimulated, but then the regimes are so swift and they are so ergonomically made that our patients don't land up in ovarian stimulation since years together, because the best way is to not transfer the embryo in a particular cycle and go for elective freezing, so that you transfer in a cycle where patient is without any stimulation, the ovaries have whitened, and it's a better situation. Of course, multiple pregnancy, high order multiple pregnancy is a very serious, I feel, outcome of an IVF cycle. I don't think people should land up with triplets or quadruplets or pentuplets. No, that should not be happening. Though IVF is a fairly safe procedure. So anybody can go through infection, which rarely happens, or twisted ovary, or there is a bleeding inside. So yes, there are these complications of IVF, but they are very rare. They are very rare.
But choosing the right facility matters the most, right? In this.
Yeah, it matters. It matters definitely, the experience of your clinician, the way they perform the procedure. But yes, even in the best of the centers, it is not that the complications will not happen, but they need to be managed. So it can happen to any odd patient.
Yes. So for someone who's looking for IVF, what would you think are the main pointers they should, keep in mind?
Yeah, it's a very important thing because see, India lacks national registry. Unlike European countries where people can go online and see what are the pregnancy rates. After all, it's the pregnancy rates which matter. But I think what is very important is that what is this whole team consistent of? So if you have like a team of clinicians, not a standalone clinician, because it is not that a clinician is well 365 days in a year, so you need a team who can take over if your primary clinician is not there. I think with proper qualifications, with fellowships in reproductive medicine, see the years of experience a particular doctor has, maybe word of mouth by different patients who have conceived. You need to know who's the embryology team, and it's very important to talk to the embryologist, because after all, the heart of IVF is the lab, which is very important. What kind of protocols are people following consistently? I think a constant protocol, and academic institutions. I think teaching is something. When you get fellows, you teach them, you learn in return, and it's an ongoing. It's like updating your knowledge on a daily basis. When you have and the backup is very important. Like in my setup, I know we have ICU, we have OTs, we have all the teams available around the clock. So if there is a problem with the patient, they need not run away, run to different places. You know that everything is managed under one roof. So that's also very important. So the credibility.
Yes, it's not just it's not just the physicality of it, the mental, emotional state of the woman and the man too matters like really much in it, right?
Okay. So it's not.
And yes, okay. How costly is the IVF procedure in India? And do you think, ma'am, someone from below like low income family, would they be able to consider IVF?
This is a very unique situation in India, because if you go even in China, the IVF is so standardized. And none of the places where IVFs are standardized, the cost can be low. It cannot be, because if you have to give the right results, there has to be a standard cost to IVF cycle. Still, I would say that the cost of IVF cycle as compared to Western countries is maybe 1/3 or maybe 1/5, I would say, which is so much more affordable. So typically, an IVF cycle. So IVF cycle is not just IVF; it also involves ultrasounds. It also involves hormonal tests. It also involves injectables. The better injectables you give would cost, So it's very variable. But yes, a very standard center will have a standard charge for IVF. I would say. The patients come, are there any discounts or are there any packages? I would say, a standard practice is very important. Whether it is patient A, B, or C, unless there is a standard patient, the results cannot come.
Okay, all right. So in this pandemic, do you think the rising number of death has impacted the IVF field in all over the world?
See, our IVF patients are more or less very young patients. Okay, so we are not looking at the challenge of mortality in this group. They are scared because also the borders were sealed for some time. Then there was a complete lockdown. We made so many protocols, and slowly patients were very skeptical coming and starting IVF. But every month I'm seeing that the number of cases are increasing. All those couples, now they are understanding that we need to go through fertility services, especially patients who have a borderline ovarian reserve. They cannot wait for 1 year. It's already been, 10 months. So I can see that patients are now coming forward, and when they see and come to the hospital or my clinic and they see the protocol, confident, and they know that yes, we can go ahead with IVF because per se coming to the hospitals is not increasing the risk of IVF, COVID. So the COVID will happen. You don't have your mask on, or you don't have your social distancing at home or at your friend's circle. So every time a patient has come positive, I know that they also know that, it was from one of the family members. The family members got it from the relatives, or they went attended a wedding, somebody came positive. So it happens, going to the malls. So yeah. So those the kind of.
Yeah, so that is definitely an impact. And we have one more question. Can you shed some light on egg donation and egg freezing? Okay, it's something which has become common actually now.
Egg donation is only indicated for medical reasons, for women who are not producing eggs, who have failed from who had premature ovarian failures. some genetic issues where they don't want to use their egg. So I would say donor egg IVF is only 10% of your all IVF cycles. So like we do about 100 suppose pickups in a month. Maybe the donor cycles would be 8 or 10, not more than that. So this is the real indication of egg donation. Egg freezing is a different issue. Egg freezing is, and yes, I'm very big time offering it to cancer patients, fertility preservation. They are unmarried or they are married, but they want to preserve their eggs because they know that this cancer therapy will hamper their ovaries and ovarian function. And on top of it, yes, some people get it done for social freezing where they know that she's 35, she's not finding a partner right now by the time she finds. So if that is the case, then the ideal age for egg freezing would be in early 30s. Sometimes, they have metabolic disorders. So egg freezing is not like a social egg freezing more so, but it could be medical. And believe me that if we analyze, then I can't recall many patients who have come and used them as such. They're right now going more and more in the tanks, but how many people will realistically use is also, a question. But yes, the high-end centers can achieve results of egg freezing. So it's very important that only those centers should offer egg freezing where the basic results are very high. So if your basic IVF results are not high, then do not indulge in egg freezing because then you are, causing a disaster.
Okay, all right. Okay, as a gynecologist, do you think the number of women wanting to get pregnant have reduced, in the past years, or has it increased? Like,
no, I don't see that. Yes, delaying fertility is a trend in urban setups, especially women who are very career oriented. Everyone wants to have a family. Generally, I don't see a trend in India where they don't want to have a family. Not very prevalent still. And I don't see the trend of reducing. I think we are a very populous country.
yeah, it keeps continuing. So one more thing, is there a way to know which IVF center or clinic is authentic? Like as I had asked
Very good
before.
question, but I think the number of years they've been practicing, the number of cycles they have been doing, the kind of clinical teams they have, and transparency. It's very, very important that when you do an IVF cycle, you have to give a complete detail of the IVF cycle. What was the number of eggs? What was the stimulation? What was the number of embryos? How many did you freeze? What kind of embryos have you frozen? So all the details, which are given in a transparent manner. No eggs, please declare. No embryos, please declare the patient. It's not that every cycle, it is not possible that 100 on 100 patients will make embryos. So it's very important for patients to know that. And the embryological team, the kind of lab setups they have, and the whole backup they have, I think is very important. So
yes, like basically you need to research so well, like compare between the different and everything.
It's not advertisement.
And how
Credibility of a center, not at all.
You can't just it's not like a spur of the moment decision that you decide and then just go in and get it done. It has to be well researched, like from a health perspective as well as the emotional perspective.
Is always patient. One happy patient, and then there is another 2 more patients sitting in your unit. So it's always like this.
And how long is the procedure, ma'am? Like if a man, like if a couple decide to do it or if a woman decide to do it, how long will it take? How long is the procedure? Like the
So I
number of days?
think it takes about 2 weeks. And embryo transfer now, the paradigm has changed. You don't say that picking up the egg in one cycle and transferring in the same cycle. It is picking up egg in the one cycle and deciding when to transfer in the same cycle or in a frozen cycle. So it's very dependent. But yes, looking at one fresh cycle and one frozen cycle, then we're looking at 2 months. So patients who are coming from other countries, I always tell them that keep at least 2.5 months in hand. But those who are from the same city, about 2 to 3 weeks. And then there are so many fellows who have been trained under us. So when they are in different cities, there are so many patients who get their IVF started there and they can come easily for your egg collection, and which reduces the time, of stay in Delhi.
Yes, ma'am. Okay, so one of the viewers have asked a question. At times, people are skeptical about IVF, which is true. They think IVF is wrong as per social taboos and everything, cultural restrictions. What do you have to say about that? We did talk about this.
Yeah, it's very important for couples to understand that IVF is just a mode of achieving fertilizations. It is just
Yes.
those 5 days which is happening in the tubes, and that's about it. The whole process of pregnancy is like a natural pregnancy, barring, yes, some hormonal support is required, but it is the same egg and it is the same sperm which could not fertilize in the body. So we're trying to do it outside.
It's so IVF, while the name has a procedure, it's as natural as it can be. It's just that, an external, how do I put it? A force is just, mediator is working towards, better fertilization.
I would say
More or
yes,
less.
IVF is different because you are manipulating the eggs and sperm outside. However, should not be a social taboo attached to it because it is just a mode of fertilization, and that's about it.
All right. Do we have any more questions? In your experience, ma'am, have you had any, special cases or something that was, totally out of the, completely random, something that's interesting cases, where people have more than.
Every now and then we get, like very recently, a young girl comes, a doctor, and has a cancer, and she has to go through a chemotherapy. So it's very important that before that is started, she will go through like a stem cell transplantation. She needs to preserve her eggs. So, that's challenging because we have to find the right time to do it and we have to quickly do it because then she has to go through the next procedure. Or I've had cases where, they've come with previous 8 IVF failed, and then they have conceived, with the right thought process, the right approach, maybe the embryos, the advanced technology, what we have offered them in one go with us. And then there are these, I remember very difficult cases like renal transplant patients or patients who have had hip replacements coming where even positioning is so difficult, giving anesthesia is so difficult. Yes, all the high risk cases who come can be dealt only in big institutions because they need a multidisciplinary approach and a way to go about it.
Yes, yes. Like for example, if someone have started their IVF and in the middle of the process they want to stop it, how will that impact their body? Is it possible?
So yeah, see, I've had cases where she landed up with dengue in the middle of stimulation. So nothing really happens. We can give you some certain 4 or 5 days of medication to reduce your hormone levels. So just starting IVF and stopping it, say after 5 or 6 days of drugs can happen because suppose today's scenario you turn out to be COVID positive suddenly. So we will have to stop, and then there's a way to control it. So generally they will not land up with any complication or their reduction in their fertility in future. No.
Okay. Okay. And we have one more final question. How do you help patients who have failed cases of IVF? I mean, they must be going through emotional breakdown and, they've taken something so large to their heart and mind and it has failed. Like do you have a specialist psychologist to deal with the emotional
Yes.
trauma?
We have a whole psychological team. We in fact have 4 or 5 psychologists. I remember once I told a patient about going ahead with another IVF, and she said the first thing I want you to is just hear me. So I think hearing out the patient, keeping them in little privacy, a better environment, a secluded environment for them, giving them more time. There are instances where a couple comes with a very large file and I'm in a busy OPD. I tell them that can you wait for some half an hour more, and then I at length I sit and see their file. So I sometimes even call them at a particular time where I can give more time to them. So I think what is important is going through their previous failed cases and histories in detail and trying to gather what went wrong and then making a plan in conjunction with your embryologist is very important, and that empathy. If we don't have that empathy, then patients will lose the confidence. So having the confidence, because
that is one, primary factor a gynecologist or an IVF specialist should have: empathy towards the patients. Because I've heard cases of gynecologists, being, completely mean to their patients who have, miscarriages or something, and, they tell like, we can't really
I
help
wouldn't call it
you.
mean, but sometimes you could be in a very busy OPDs and you may feel that there is a lack of time. So I think like yesterday I saw a patient who's had 12 miscarriages and 2 tubal pregnancies. So I know that they are so disturbed. So giving them a little bit of more hearing and, seeing them and giving a little bit of more time in your OPD, or maybe calling them at a later time where you have more quality time for them, is something which works well, which I've identified over a period of years.
Okay. Do we have any more questions? Looks like we are done with the questions. So while we are wrapping it up, ma'am, what do you have to tell, couple or women, anybody who is, looking or thinking about IVF, what do you have to tell to them?
Okay, so since we are stepping into the new year, I want to wish everyone a very happy new year. And I think what we must have within us is positivity. If you are not positive, towards a treatment or towards the advice, then it will not work. So when you step in for your treatment, be very positive, have scientific, answers given to you, have these questions why it's okay, why you are suggesting this, why you're suggesting a surgery, and I should be able to answer that question in a manner where you can understand. I think stepping into any treatment is easy if you can understand what is the realistic expectation. This is called realistic expectation. I put it that what are your chances of success? Not everyone is in the same boat. And this is how I think it can work for most of the couples. After all, most of the couples go happy. So this is what is important.
That's great.
So most of them, they achieve a child, and that is their basic aim when they come to us.
That's good news. Yeah. Okay, so it has really been informative, ma'am. Like you kind of simplified IVF for us, and for the viewers as well. I'm really, sure of that. Yeah, it has, and yeah, we look forward to having more, talks with you. Actually, been
Sure.
really good, and yeah, thank you so much, ma'am.
Thank you.
Hope you have a good time. Bye. Bye, guys.